So today we're going to talk about post-liposuction rolling. And this is a small roller, and this is the big daddy. This is a big roller. And this is what we're going to use after liposuction in order to help contour the skin. We're basically going to roll these objects on top of the body in order to make sure that the skin is as smooth as possible. It stimulates the skin, it makes the fat layer even, helps the skin to retract, and it's real important. We usually start this about 2 weeks after your procedure. In the case we're talking about today, I did a almost 4,500 cc liposuction. That's a pretty big liposuction. The typical areas are the abdominal, the mid to upper back, posterolateral flanks here, maybe the thighs, upper medial legs. So these are all the areas that we're going to talk about treating these with rollers today. Okay, this willing patient is about 3 weeks after a liposuction, and remarkably, she has no bruising, which is pretty impressive. That's probably because of the arnica and the bromelain that we use. But the areas that we treated was her entire abdominal region, her upper medial thighs, turn around, and this whole area right through here. So that's the predominant area. We didn't do anything back through here because we thought she's great and she's got a great tuchus, so we're all good here. But you can see the beautiful contour, although you don't have her pre-op here, but this has all been contoured beautifully. Her skin is actually lying down really nice. Okay, turn around. So this is a liposuction incision here. They're very tiny. Probably a small one over here. That's a tiny one over there. And then she'll have 2 small ones on her backside. But already you can see a remarkable difference. In fact, she's a little bit firm here, and the reason why she's firm is because you can feel her fascia now. That's a common discovery after a liposuction. If you have a layer of fat and all of a sudden we contour that down so it's much thinner, you can feel that hard stuff, and that hard stuff is actually your fascia. So in her particular case, we're going to roll her abdominal area and her thighs towards her groin, because the groin is where the lymph nodes are. Think of the lymph nodes as the basin or the drain site that's going to take all the fluid from here and put it back into your system and get it out. So you can have a small roller, and you could roll this over the skin any way you want, essentially towards your groin, like this. And anything that just squeezes the tissue, you can use some pretty good firmness, can make a big difference. Same thing for the upper thigh. Open your leg here. This is an area that typically can be more prone for some knots, because you have all the lymph nodes in this region over here. So again, you roll up towards the groin. You should do this 2 or 3 times a day, 20 or 30 minutes. If you don't have a roller, you can simply just use your hand, but these rollers really come in handy. Roll everything towards your lymph nodes, up and down, towards the lymph nodes. And as you can see, I'm pushing it pretty firmly because you have to squeeze that water out of the tissues. Okay, turn around. Now for the back side, it's a little harder to get back there with a small one-handed roller, so we might bring out the big daddy. It doesn't have to be exactly this one. This one is a high-end one. I think we picked this up at Walmart, but they're not that expensive. But again, the idea is to roll up through these crevices, right in the small of your back here, and up the flanks. And the reason why I like the two-handed roller is that the patient themselves can use the roller. Okay, so I'm going to ask you is to come on back here, grab that roller, and roll it up. There you go. So you can see it's very easy for the patient to just follow their contour, follow their curves, and just roll this really nicely. And you can even get in the back side of the upper back if you had to with this technique. And you're pressing firmly and slowly, and you're squeezing the water out of the tissue and mobilizing it. And this is how you're going to get those really nice results. These 2 little rollers are easily purchased for just a few bucks, and they can make a huge difference in your outcome. I encourage all my liposuction patients to start rolling about 2 weeks after the procedure, which is about the time when it feels the best. It actually may hurt a little bit in the beginning, but once you start rolling it out on a regular basis, it actually feels really, really good. So you got the big daddy and the small daddy, There are permutations of these two, but I encourage all my liposuction patients to get on the rolling bandwagon.